So lots of questions about the cost of dental implants. What
Yeah.
affects the cost?
So Randy, I don't want to leave anything out. I have a cheat sheet here, so I don't forget. Okay. The number one thing that affects the cost of the dental implants and permanent teeth is, in most scenarios, the number of doctors that are involved. Okay. In the traditional sense, patients would have to go to one doctor to get the implants placed, and then another doctor to get the permanent teeth put in, and then another doctor to handle the maintenance and cleaning. We're able to bypass all of those costs by doing it in-house. Okay. We do all of our work in-house, including making the teeth in-house. We're able to do it all in one place. Okay. The number two cost driver is the type of implant.
Are there lots of different implants?
Randy, there are websites dedicated to cataloging all the different types of implants. There's thousands and thousands of different types of implants, and they all vary in quality. They all vary in quality by manufacturer, where they're manufactured, what kind of warranty they cover. I use a gold standard implant in my office.
Okay.
Okay. The number three thing, and I touched on this earlier, is the big lab bill. Okay. So when I say lab bill, in most traditional offices, the dentist has to send impressions or scans of your mouth to a third party off-site to fabricate the design and then actually fabricate the teeth, and then they send it back to the office. So they have this hefty bill they have to pay someone to actually make the teeth.
Did you used to do it that way?
I did do it that way for a long time.
What if you had to do it like that again?
Oh, it was so frustrating.
Okay.
Because a lot of times, and this is a secret no one wants to tell you, is sometimes it doesn't fit when it comes back. And then the patient is left in limbo, waiting for their permanent teeth.
Back and forth?
Back and forth and back and forth. And I'll admit this, when I first started doing these, I was a victim of that. I had patients that were back and forth because I didn't know how great it is to have your lab in office. Now I do. And I provide that to my patients. This on-site lab makes it so much better. Another thing that affects the cost is dental insurance.
Yeah, what does it cover?
Unfortunately, in this case, not a lot. Okay. Most PPO type plans will cover $1,000 to maybe $2,000 a year. So they can kick in some, and then Medicare, Medicaid, we wish they'd covered it, but they don't cover it. We would love for health insurance to cover it. It doesn't cover it. So the good news is we have financing in place that can help you get this treatment and make payments in an affordable way.
Do people finance this?
Yeah, Randy, most people finance it. Okay. I would say 80% of my patients finance it. Even with those with bad credit, we have finance options that are able to approve most people in some degree.
Can they get a cosigner?
Yeah, they can get a cosigner. In fact, and most people don't know this, if you have a 401k or retirement, you can actually borrow against your retirement because this is considered a qualified medical expense.
Okay.
And that's
so there's no penalty to borrow against.
No penalty.
I mean, have you had people that borrow against their 401k?
Number of people have borrowed against their 401k for that. And they tell me, Dr. Miller, this is what I saved for. This is what I worked so hard for in my life. I don't want to die with bad teeth with money in my bank account. I want to use it. I want to use it while I'm living.
Plus, it helps, by the way. You're about half off.
I'm about half off.
As of today's date, because we Googled it, you told me.
Yeah.
You're about half off of
I'm about half off of
just because you have an in-house lab.
I have in-house lab.
You don't have to outsource pretty much anything.
Nothing is outsourced.
Okay.
And I'm able to keep costs low for my patients.
Okay. What else affects the cost?
Sometimes when you see an ad, it will maybe misrepresent what you're getting, because sometimes dental implants are on a snap-in, or sometimes they're permanent. Okay, and that's going to drive the cost. So sometimes you'll see an ad that says, implant teeth for a low price, and what you're getting is
a denture.
A denture.
Okay.
And what we're talking about here is not a denture. We're talking about permanent teeth that don't come out. The next thing that affects the cost is what those teeth are going to be made out of.
Okay.
Okay. There are lots of different materials that you can make the permanent teeth out of.
Are there a lot of ways to cut corners as a dentist?
Oh yeah. Oh yeah. So a lot of times when you're seeing a low price, what you're getting is a temporary type material.
Okay.
And it's not going to last a long time. It's not going to be very strong. In my office, you're going to get a zirconia smile, which is made out of a really strong material.
Is that considered like
that is the gold standard, best in dentistry? It's translucent. It looks beautiful. It looks like natural teeth, and it can stand up to the chewing that you want to do.
Okay.
What I see a lot of times is other offices are using for their permanent teeth what I use for my temporary teeth.
And those only last like 3 months, right?
Yeah, they break really easy.
So you don't like those?
I don't like that at all. And that actually can cause the implants underneath to fail. It can cause you to have a litany of problems.
Okay.
And so it's very important that we finish this with the proper material. The other thing that affects the cost is the extent of the surgery that's required.
Okay.
Okay. And so when you go to some offices, there's going to be charges for the extractions, bone graft, gum surgery, bone reduction, a number of procedures that are going to get added on to make that cost skyrocket. I'm able to keep costs down because when I see patients, I include it all into one inclusive price.
Okay. And you're usually less.
And I'm always less. Not usually, I'm always less.
Okay, good. What else affects the cost?
And the other thing that affects the cost is the experience of the surgeon. Now, when you come see me, I have a lot of experience and I keep the cost low.
So is the goal to get it done right the first time? I mean, logically, that makes sense.
You know, my old football coach once said, do it right, do it light. You do it wrong, you do it long.
Okay.
Okay. What I mean by that is we got to do this right the first time. You don't want to take chances with your body. You don't want to take a risk and doing slipshod work when you want to get this done the right way, the right time.
So to minimize risk, you want to go to somebody with a lot of experience.
To minimize risk, you definitely want to see someone with a lot of experience. If you see someone that maybe this is only their first or second case, they might offer you a low price, but you're going to be left with a lot of problems, potentially.
You know, I wanted to ask you this, because I interviewed a dentist recently. He said he met a patient that they spent $10,000 on bone grafting over 12 months, and they still didn't get an implant.
Yeah.
But how does that happen? Is that inexperience? Because you told me earlier that you don't do a lot of bone grafting.
I don't do a lot.
That might be old school thinking.
I will do bone grafting at the time of the surgery.
Okay.
Okay. But I don't do standalone bone grafting as a rule. I think that's maybe some.
Has that been proven not to be?
I think that's maybe an antiquated way of doing it. You know, the old way to do this would have been to remove all the teeth, place bone graft, and then heal for a year with no teeth. And then the poor patient is left with nothing for a year and they're miserable. Nobody wants to do that.
And you could do, I mean, somebody watching this right now,
Yeah.
if you had room in your schedule, the day after tomorrow, they could have their
They could
teeth.
call the number for my office, and if they caught me on the right day, they could come see me that morning, and I could even do the permanent teeth that same day.
That day. Have you ever done that before?
I have. It doesn't happen very often.
Okay.
But you know, most people will schedule back in a day or two or a week. But I have done that in the same day. It was a person that was just anxious to get started. And they wanted to get going, and it went great.
Now, you're a local guy. I mean,
Yeah.
aren't you practicing like 5 or 10 minutes from where you grew up?
Yeah, I grew up just we practice in East Mesa, and I grew up in West Mesa. I lived in Arizona my whole life.
So no more dentures.
No more dentures.
So when a patient calls your practice and says, "Doc, how much is it?" It may be misleading because you have to see them first. That's the only catch to this.
You know what?
You got to be seen first.
No, there's no catch. When they call my office,
I mean, but the catch is you want to see them
the
first.
catch is that they need to see me first. They need to come in and let me look at you.
Then you could give them a price.
Yeah, but the price is it's I don't nickel and dime my patients. Okay, that's the way I do business. I've always done business that way. I've always treated my patients that way. I don't nickel and dime people. I give an all-inclusive price for this procedure, and that's the right way to do it. I treat people the way I want to be treated.